A new study should concern anyone who's ever gotten or will ever get a heart bypass operation. Researchers found 5 years after their operation that 40% of patients had significant brain damage. In those 5 years, their brains had aged 20 years. Dr. Michael Breen is here with more on the study.
David, this study just confirms what heart surgeons have long known, that a bypass is far riskier than most patients think. It often produces mental changes, and those changes can last a lifetime. 400,000 people get bypass surgery every year. The new study shows many will pay a price they never expected. 5 years after their bypasses, 40% of patients had brain damage. Those people had an average 20% drop in their mental ability. Their problems included problems with concentration and memory.
A piano teacher who had taught how to read notes to many students for years, forgetting now how to read notes herself.
That's minor.
Correct.
Such problems are so common, some experts have this advice.
They may want to actually get a baseline neuropsychological examination before undergoing such open heart surgery.
What causes that brain injury? One theory is during surgery, the heart-lung pump doesn't deliver enough blood to the brain. Another problem, attaching that pump dislodges over 1,000 particles in your blood like this one. They go straight to your brain and may cause small strokes. But here's what's important. There's a way to prevent those problems. Some centers, like here at the University of Chicago, are now working with a new procedure. Ed Langford just had that procedure, a 4-vessel bypass. He's 74. He has kidney failure, yet he'll probably never have any mental problems at all.
Oh, I feel good. Real good about it.
Surgeons bypassed Langford's heart without using a heart-lung machine. Instead, Dr. David Jayakar used this device to bypass his heart vessels while his heart was still beating.
I've done about 65 beating hearts, and I haven't had any neurological problem in those 65 patients.
And the results with the new procedure appear to be just as lasting as they are with a traditional bypass. Dr. Jayakar says the new procedure is faster, cheaper, and today's report shows also far safer for your brain than a traditional bypass.
The bottom line advice for any patient who needs bypass surgery would be to ask a surgeon if he would be a candidate for beating heart surgery.
This new procedure also has another advantage. You're less likely to die. Your odds with a traditional bypass, about 3%. With the new procedure, less than 1%. So, Tracy, before getting a bypass, people would really do well to ask about this new procedure.
Certainly sounds like it. Thanks, Dr. Breen.